we're not there yet. I understand that people are sort of tired of the social distancing, but we're just starting to see the fruit of those efforts from 14 days ago. Let's not jump the gun prematurely. Going premature in opening means we might start all of this over again rather than sustain this for another 2-3 weeks. See that caseload really is flattened down, and then in a phased way begin to reopen. One is that we need to see the caseload really bend down low, which is an indication of decreased community transmission. Secondly, we need the ability to do testing, and we're not quite there yet. Once we have that testing, the ability to do contact tracing so that we can quarantine and isolate remaining cases. And the last one, and this is a big issue, particularly for some of our major cities, you don't want to do that unless you have hospital and medical care capacity. In other words, you don't want to trigger something happening and again have a surge demand on the medical system. It's important for two reasons. The molecular diagnostic tests we have, what you hear called RT-PCR, those are tests designed to tell us, are you currently infected or have the virus? So that's important because we're going to want to isolate those or quarantine those individuals, not let them work, for example, and transmit it to others. The other test is serology tests. These are tests done after the fact to say, were you infected in the recent past, and might that mean immunity? Obviously, the advantage of knowing that is you're not concerned about your own risk anymore, and you're able to go back to work. One other important part about doing the serology testing is to know what % of a community has been infected, because that's really a key thing.